Welcome, everyone. My name is Denise Moraita, and I'm part of the marketing team here at CCD Health, GEP's healthcare company. We appreciate you joining us today for this live session, Mastering Patient Access. We are super excited to talk about a critical aspect of healthcare management, which is patient access. In today's evolving healthcare landscape, efficient patient access and scheduling have become more crucial than ever. As the Medical Group Management Association reports, only 20% of medical groups improved patient access in the US last year, highlighting a pressing need for innovative solutions in this area. Our webinar today will address the challenges head-on, offering insights and strategies to optimize your patient management systems. We will explore how to focus on people first, streamline processes, and leverage technology to enhance patient access across primary care, specialty care, and emergency care settings. To guide us through this topic, we have two experts on the subject with us today. First, I'm pleased to introduce to you Will Scott. Will is CCD Health's Vice President of Business Development. He brings over 20 years of experience in radiology management, and he holds a master's degree in healthcare management. His extensive background in medical imaging software and healthcare operations provides a unique perspective on the challenges and opportunities in patient access. Welcome, Will.
Thank you.
Joining Will is Stevenson Pierre, CCD Health Director of Operations. Stevenson brings more than 13 years of expertise in the VPO industry, with degrees in financial analysis and leadership principles from Harvard University, as well as a senior management certification. Stevenson, I think you can offer a lot of valuable insights into operational excellence and continuous improvement in healthcare settings. Thank you for being with us today.
It's good to be here.
Through this webinar, Will and Stevenson will cover the importance of efficient patient access, common issues in patient scheduling, strategies for streamlined healthcare scheduling, and key metrics to measure patient access and scheduling performance. For all the attendees, we'll conclude with a Q&A session, giving you guys the opportunity to engage directly with Will and Stevenson. So please feel free to type any questions you may have, and we will tackle them at the end of the session, okay? So let's start the journey towards mastering patient access. So I'll hand it over to you, Will and Stevenson, and I hope the audience enjoys this session. Thank you.
Thank you, Dennis. So moving into our first section here. There we go. So we're going to be first discussing leading patient contact solutions and BPO provider healthcare for the radiology industry in the United States. We like to talk about a few things when we first go into what really makes up patient contact solutions. One of them is workforce management. One of the things that we're really good at and what we pride ourselves on here at CCD is our ability to recruit, train, and staff qualified patient care specialists, immediately helping you reduce or eliminate drop calls and absorbing the HR risks on your behalf. What that does is it gives you the opportunity to make sure that your patients are receiving the best possible patient care experience when it comes to scheduling their appointments, because we understand that patient care is a lot different than customer service, right? Patient care deals with people who have ailments, people who have reasons to be calling into a healthcare facility to have tests done and things of that nature. We want to help make sure that that experience is as smooth as possible. Number two is our operational continuous improvement. Here at CCD, our operations team specializes in developing innovative solutions for appointment confirmation and improving overall facility efficiencies and profitability. What does that mean for you as a healthcare organization? What that means is that we are continuously looking for opportunities to tackle different challenges as it relates to patient access and patient scheduling services. And in turn, what that does is it helps not only improve your facility efficiencies, but also helps with their bottom line, because we do understand that every missed call or every drop call has an opportunity to affect your bottom line revenue. And we don't want that. So one of the things that we really try to drive is making sure that your equipment is being utilized effectively and efficiently, and also that your patient throughput is happening at a very good clip. And last but not least is our data-driven insights. And what that means is that we try to make sure that every decision we make in collaboration with our partners is based on data. We're a data-driven company. We're constantly looking at the metrics, looking at KPIs, understanding where are opportunities for improvement. And we share that information with our partners to make sure that they understand exactly what their data is saying to them and how they can utilize that data to make efficiency and effective improvements in their day-to-day operations. So what are some of the problems that we have encountered as it relates to the patient access across the, not just radiology, but the healthcare industry as a whole? One is, according to Medical Group Management Association, only 20% of medical groups improved their patient access in 2023. So what does that mean? So what that means is that 3 out of every 4 medical groups reported that their patient access either stayed the same or got worse during the year 2023. This was based on 2 major factors that they stated. One was the surging patient demand. As we know, the different groups, the baby boomers and now the millennial groups are now getting older, which means they're visiting the doctor more and more often. And especially in a post-pandemic world that we live in now, we just seeing a much larger surge in patient demand. System capacity is often unable to keep pace, and that creates bottlenecks and it hinders the access to medical services in a timely fashion. And number 2 is a staffing shortage. There has been a major gap realized, especially again in a post-pandemic world, between the amount of healthcare staff needed and the amount of qualified healthcare personnel that's actually available in the marketplace. And that has caused a great deal of compromises in care and quality of care across the board as it relates to our healthcare industry. So what are some solutions that we came up with, or that we have researched and found to be some of the most utilized solutions in the marketplace? One, focusing on people first. We try to make sure that we're prioritizing not only just the patient, but also the physician experience as well. We want to make sure that your referring providers out there in the marketplace also feel like the processes that are being utilized are both streamlined and effective as it relates to getting their patients seen, getting their tests done, and getting those results back to the referring providers so that the patients can experience the best care that they possibly can. Number 2, we try to optimize those processes and look for streamline opportunities in the workflows and in the protocols. So when we work with our partners, we're constantly looking at those workflows, looking at the protocols, comparing those protocols and workflows against the industry and some of the other best practices that we've seen in the industry, and making recommendations based on that data, again, back to data-driven solutions, based on that data back to our partners in order for them to make better decisions and hopefully streamline their processes to make things more efficient for both their patients and the referring providers. And number 3, last but not least, we try to leverage technology whenever and wherever possible. This just helps us implement more and more tools to help support the human efforts, not ever getting rid of the human being, because in healthcare, we understand that empathy is a large part of the healthcare industry. Again, difference between patient care and customer care. But we do want to utilize technology solutions whenever possible to help enhance and help streamline some of the processes that our humans are going through on a day-to-day basis. So we looked at the 3 different categories as it relates to patient care, to include primary care, specialty care, and emergency care. What we found is that there are some pretty unique patient access issues as it relates to each one of these particular categories. Primary care, we've seen long wait times, we've seen communication barriers, and we've seen inadequate follow-ups, just to name a few. In specialty care, We've seen referral and authorization delays. We've seen high turnover rates as it relates to staffing. We've also seen some of those same communication communication barriers as well. And then one that really stood out was coding inefficiencies as well. That's more on the back end as it relates to the revenue cycle management and billing. But it does seem to be a bit of an issue as it relates to specialty care in particular. And last but not least is our emergency care category. We've seen some triage inefficiencies, again, long wait times and high turnover rates and staffing issues as well. So as you can see, is across those three industries, there are some nuances, but the base issues that seem to really stand out as far as those three categories is high turnover rates, staffing issues, and communication barriers. So those are three things that we try to attack immediately when we partner with any healthcare facility or healthcare provider out there in the industry.
So while you're talking about the different issues, once you go through the patient journey, I'll go ahead and speak a bit about those indicators that one has to be on the lookout for.
You want to go back one slide? There we go.
No, I'll just speak about it a bit further down. You could go over the patient journey first. It's fine.
Absolutely.
Mhm.
So when we talk about the patient journey, this slide is kind of busy. We won't go through the whole thing, but we do understand that there's a couple of key points or key places in the patient journey that really seem to be opportunities for improvement and just areas you want to look out for as it relates to your patient journey and how they are able to get their results at the end of the day. One is making sure that order after that patient visits their primary care provider, making sure that the orders are received and put into the EMR in a timely and effective way, making sure that their authorizations are taken care of properly, and making sure that not only do they have coverage, but the type of test that they need to have done is actually covered, what their out-of-pocket costs may be. Those are things that are important to a patient as well. Also making sure that they're properly scheduled for their appointment and they understand their pre-appointment instructions, things of that nature, so that they are not showing up on the day of their appointment either late, at the wrong facility, or without proper pre-appointment instructions, whether that's not eating anything the day of the appointment, et cetera, et cetera. Once the patient has arrived for their appointment, then we want to make sure that the patient is not only seen in a timely manner, but also make sure that their results are passed back to the referring provider in a timely manner so that they can get the proper care that they need in the time that they need it. And last but not least, always is, a sore spot for any patient, all of us that have been patients included, right, is the billing portion. So we want to make sure that that portion is also taken care of effectively, properly, and accurately, so that the patients understand what their out-of-pocket costs might be, and that's another layer of anxiety that we can hopefully help eliminate for that patient during the course of their journey. And we understand that patients may go through this journey several times. So we want to make sure that each time they go through this journey, it doesn't become more difficult for them. It becomes easier for them because the processes, the protocols, and the workflows are in place in the proper way.
So speaking about some of those indicators that would tell you that you have an issue with patient access, because we're always talking about those issues that come up along the way. So those indicators, some of them are really connected and they do tell a story. They're raising that flag that you have to pay attention to. So the first things will just connect long wait time and high call abandon rate. So the longer a patient has to wait to get an appointment scheduled or to speak to a practitioner or whatnot, the easier it's going to be and the faster they're going to abandon the call. So imagine having to wait over 5 minutes just so you can say, I'm in pain and I need to schedule an appointment. So what's that telling you? We talked about that red flag that it actually raises. It's actually telling you that you're either understaffed, you have a staffing issue, or your phone tree is not properly optimized where the calls are not being routed correctly. And everyone is just waiting on a big pod and then waiting to speak to the person that can possibly help with the issue. Overburdened staff is another thing that can happen if you're not properly staffed. So your literally opening the door to where your team is going to be burnt out because a number of calls are coming in, a number of requests are coming in, and you don't have enough people to actually respond to those. What's going to happen then? Then it's also going to cause attrition. So with attrition comes what we're all scared of. We're losing legacy knowledge. Then we have to prepare new folks to start helping the customers or the patients. And what does that mean? There's a long learning curve where we have to allow them time to pick up on the knowledge, to understand the processes internally, to understand the impact overall. And that's only affecting your patient-based satisfaction level. High no-show rate is another thing that's actually raising that flag, and it's connected to frequent cancellation. If the level of service that I'm receiving doesn't satisfy my needs based on maybe my demographics, because I would rather interact with a machine, or I want that hybrid service between the machine that gets me faster to someone that will actually schedule my appointment, then I'll try to start fishing elsewhere. I'll start shopping around. I'll start shopping around. Frequent cancellation can also come from that long wait time. Since I had to wait so long on the phone to get to someone to schedule my appointment, does it not mean that I'll have to wait a lot when I get to the center to get my exam performed? Another thing, low referral completion. The more bad feedback the patients are going to be telling their doctor that I had to wait longer. When I got there, no one was there to was able to assist me, or I walked in and I was not told properly in regards to the preps that I had to do before I getting to the center. Because the staff was burnt out, attrition caused loss of legacy knowledge, then doctors will stop referring patients to your center. So far, we talked a bit about those indicators, and next we'll just jump right into some of the strategies to really improve that scheduling experience for the patients. So here you can see that it talks a bit about optimizing call handling, improving that overall experience, and also standardizing the phone management. But we'll summarize this with a few items. We'll first talk about real-time queue management. It's very important for you to pay attention to what's coming in, because from what's coming in, you can determine how many folks do I need to satisfy that number of calls that I'm receiving. And being able to satisfy the number of calls that you're receiving will fall onto patient satisfaction, because patient satisfaction is one of the big targets that we have. Proper and efficient phone tree. That item, we'll talk a bit more about it further, but we'll dive into training your folks and developing them. So I talked a bit about avoiding burnouts. Avoiding burnouts guarantees that your folks will stay longer. So that means that you have to train less often. So if you make sure that the training process gives them all the tools to be able to do the job, and you're training the right number of folks for doing the job, that also helps you improve the overall patient access experience. The other thing is, once you've trained these folks, you make sure you have the right number of people to do the job. How are we going to ensure that they're keeping up with the quality of service that you want to provide? Then live monitoring is one of your strategies for the quality management portion of it. Why live monitoring? Why not just go with conventional regular call recording evaluation? Well, live call monitoring allows you to hear the issue happening, correct it while it's happening before it affects your patient. So being able to stop it from being an issue after the fact, that also builds up on your staff self-confidence, since they know that they have the proper support that's listening to them and then real-time correcting the errors that they may be making. Because the lower the error, the better, the higher the patient satisfaction, and the better it'll be on your clinic, since you'll get more referrals from doctors. And one thing that I know I talk a lot about the specific KPI. So I want to go down to like not something too hard in regards to product knowledge, but rather that soft skill portion of it. Sometimes it really doesn't matter what information I'm given, but rather the way it's given to me. So soft skill plays a big role in what level of satisfaction you'll actually receive from your patients. Since the level of professionalism, understanding through empathy, the pain that the person is currently going through, depending on what specialty that you work with, of course. If the person's in pain, or if this is a kind of exam that you have to really care of whether the person has an allergy or not. If there's something that's going to be injected that will cause that allergic reaction, if the exam requires 30-minute wait time before they actually get someone to assist them, you have to make sure that you're setting proper expectation. So this all plays a role in the big professionalism part of soft skill per se. And last but not least, I want to speak about knowledge bank, knowledge base, or however you want to call it. It's somewhere where you have all information stored. That way, I don't depend on someone else to give me the information when I'm assisting the patients, but I can go ahead and look for it myself, because that creates that, again, that sense of self-confidence. And it also builds up on my knowledge where I can read about certain procedures or specific exams while I'm not on a call. And that way it builds up on that legacy knowledge that we're protecting so much. So having a knowledge bank that has common scenarios, not just this is the type of injection for CT or CAT scan or whatnot, but rather this is what could happen if you don't do this. If you don't ask a question in regards to deodorant before this specific exam, the person will not be able to get it completed. Then that will be another trip to the center, which affects patient satisfaction directly. Verbiage of specific things to say when you're on the interaction with the patients, because we understand that it may happen that you've hired someone with no experience, that maybe experienced at some level in healthcare, however, not very familiar with that specialty that you're working with at that moment. So you have to have the verbiage available that they can refer back to, that when they're speaking, they don't only feel confident with the information that they're handling, but they're confident about the way that they're transmitting the message. Now, let's take a look at the phone tree. So I did promise that we were going to go over it a little bit in depth, since I believe that this is one of the most important thing when it comes to pairing the human experience with the technology. So what does it all mean when we talk about an optimized phone tree, as it says on here? So the phone tree, what does it do? It really involves designing that phone system in the healthcare experience so that the patient can quickly and efficiently reach the appropriate department or the specialized representative that they need to speak to get the service that they need. And the goal is really to just simplify that patient journey that Will was speaking of when they need an assistance with scheduling an appointment or even getting the results for an exam that was performed. Why does it matter so much? As you guys can see on the screen, it shows X-ray, CT, mammo, and MRIs. So what does that mean? It's a well-structured phone tree, which reduces that frustration that you may feel by not knowing what to click on as you're calling. If the IVR just simply tells me if you want to schedule an exam, press 1, and then I'm just going to get to someone that will try to identify what kind of exam that I want to schedule, but rather says for X-ray, press 1, CT, press 2, mammo, 3, and so on, that really improves not just my level of satisfaction, but it'll reduce my will of really abandoning that call. So it will reduce your abandon rate, since I know that I will get someone that will assist me with that specific exam I need. And once the specialist receives the call, when you, again, connecting that technology with that human experience, when the specialist receives the call, the indicator will tell them this patient is calling for a CT, for an X-ray, and the flow that will be displayed will be specifically for that exam that is being scheduled. So talked a lot about the technology, but by making it easier for the patient to connect, but also for the right personnel, properly trained person to handle the interaction, it'll make the entire experience from dialing in until you hang up after the appointment was scheduled a lot easier. And of course, having specialized resources to attend the calls will also affect your wait time, since the easier and the more versed I am at resolving or answering questions in regards to a specific exam, the faster I'll transition from one interaction to the next. Now, the key components of having an optimized phone tree, it would help you understand what the patient needs are. You'll analyze those common patient inquiries, just to make sure that you're tailoring your phone tree to what's really being requested. Now, if something is just a once in a blue moon, or you get 1 or 2 exams every week, then that's something that you could maybe categorize it as other or miscellaneous, or however you want to do it, or actually add an option for that specific exam if your list of exams are limited. Another thing is user testing. Optimizing is it's an ongoing process. It doesn't start today and ends tomorrow, but it starts today, pauses tomorrow, and starts over right away, so it can improve whatever you've created yesterday. You have to listen to what feedback you're receiving from the users, and you have to do testing yourself. And if improvements are required, apply them right away. That way you show, and it's going to be evident that you're working towards being one of the leader in what you do, not just doing the job, but also getting your folks ready to come in for the job to be done. We know that there are seasonal exams, for example, flu shots. Those can also be an improvement that you can do when you're optimizing your phone tree, updating your prompts to provide those relevant or timely information, and that will help direct those specific patients. That way they don't have to wait through maybe just hitting other or whatnot, since there's not a specific option for like flu shots. But then knowing that it's flu season, you have that additional option there for whoever wants to schedule an appointment for that. Well, I know I just talked a whole lot about the first 3 strategies that I thought of, but I know you have a few more strategies to share, and they're just as important.
Yeah, absolutely. I know you talked about the phone tree optimization and whatnot, but there's a couple of other things that we could touch on as well. One is the adoption of predictive analytics and demand forecasting. Again, going back to those data-driven insights that we talked about earlier, utilizing data to predict what trends that you might see in your patient scheduling. For instance, one of the things that we know is that every October there's Breast Cancer Awareness Month, and there's always going to be an uptick in those screening and also diagnostic mammograms, right? So those are things that we can utilize as far as our predictive analytics to make sure that we're always staffed properly, make sure that we understand seasonal dips in the scheduling as well. Maybe it's summertime, maybe during certain seasons of the year, there's dips in the schedule. So we can utilize predictive analytics to make sure that we're scheduling properly, that we're staffing properly, to make sure that their patients are being well taken care of. We also can look for other trends in the process as well. We can look for trends in your patient demand. Does your patient demand come from particular referring providers? Does it come from particular specialties? So those are things that we can utilize in order to help when it comes to making predictions, and also making sure that we understand how to take care of your patient base. One of the things that's really popular amongst our client base here and our partner base here at CCD is what we call our no-show predictive model. This is a model that we developed in-house, proprietary, and we utilized a machine learning algorithm in order to input data points based on your patient population that's already in your EMR, and utilize that information in order to predict whether or not a patient is likely or not to no-show for their appointment. How do we do that? It's based on one of the factors is based on is previous patient behavior. Have they no-show before? If a person has no-show before, they're probably likely to no-show again. Another thing that we can use is weather patterns on the day of their appointment. We can utilize distance from the location of their appointment. We can utilize out-of-pocket costs. These are all things that can indicate whether or not a patient is more likely or less likely to no-show for their appointment. And then we can utilize that data in order to create some actionable insights, right? We can either double book that appointment. We could send out additional appointment reminders to that particular patient or subset of patients. And there's a whole host of other things that we could potentially do in order to help not only make sure that patient has a higher likelihood of actually showing up for their appointment, but that we have a contingency plan in the case that they don't. And that kind of leads us into our next insight, which is offering multiple booking channels. One of the things that we've recognized is that as the patient population gets younger, More and more of them are utilizing online booking channel options. More and more of them are using portals. More and more of them are using applications on their phones or devices and things of that nature. So a traditional call in to schedule an appointment or receiving an outbound call may not be the best option for some of your patient base. But what we found is that if you utilize multiple booking channels, more than likely you'll have something that fits that particular patient or subset of patients, whether it's phone call, whether it's text message, email, online portal, application, or things of that nature. So we try to make sure that we are covering all of those things and help reduce the bottlenecks in the scheduling process. So what are some of our key metrics? And I'll lean on Stevenson a little bit to help out with this particular slide, but a couple of things that we look for as it relates to patient access and scheduling key metrics are: one, appointment availability, the ease at which patients can secure appointments. Two is the wait times or duration that patients have to wait on scheduling an appointment or being seen by a healthcare provider. And three is patient no-show rates. Again, percentage of a small percentage or at least a percentage of your scheduled appointments have a likelihood of no-showing. And we try to use those predictive insights and predictive analytics to help understand what do those no-show rates look like and what can we do about them. Stevenson, I know there's a few more things here that you may want to touch on since you work in our operational department, including our abandonment rate. So I'll let you kind of tackle that.
Yeah. So I know you went through the first three, but referral complete rate. I talked a little bit about that earlier. You have to make sure, part of what I understand is that you have to verify to see which places are referring most of my patients, and look at how many of those are repeated patient, or to not call them clients, right? And out of those patients that I'm receiving from XYZ, how many of them am I able to complete? Which is not going to raise just satisfaction in the patient themselves, but also in whomever is referring, whoever is the doctor or practitioner is that is referring those patients to me. And I feel like it's so important, because I feel like sometimes we don't really think about whether the doctor is going to be referring again or not, or if the doctor is receiving feedback about our center or not. And that seems to be something that at times we tend to forget. I don't know why, it just really bugs me, and I felt like really highlighting it. Call abandon rate is definitely something I touched on earlier with those long wait time. We did talk about the longer you have to wait, the faster you're going to drop that call. Because if I'm in pain, and not even in pain, if I don't like being on the phone for so long, and who really likes to be on the phone for long, I will drop that call if the wait time is 10. And we've seen a few instances where poor planning when it comes to staffing would cause a long wait time, hence a high abandon rate. Call handling time.
And I'll touch in just a real quick there
Yeah, go
on the
ahead.
abandonment rate, Stevenson. This is one that we really, really try to hone in on early in the relationship with any particular partner. And part of the reason why is what we've seen is that in many cases, around 25 to 27% of the time, that a patient is quote unquote abandoned, or their call is not answered in a timely manner, and they actually are dropped from that call wait list. Around 25 to 27% of the time, you lose that patient. It's not for good, at least for a time. And what happens is they usually will either call a competitor, they'll go somewhere else outside of your network, or they may forego their healthcare in totality. Because one of the things that we all know is that healthcare, our personal healthcare, is one of the things that, especially if it's a financial issue, that we will abandon first as human beings. So we found that in a large instance of cases, you never get those calls back once a patient has gone into abandonment, and that immediately affects your bottom line and your revenue. And so those are things that we try to tackle very early in the relationship. Just want to kind of touch on that, but Stevenson, please continue.
Yeah, thank you. And as you were speaking, for some reason, I started looking at the patient no-show rate again. And I thought about one of the strategies that we use in order to avoid some of the no-show, because we know that we may not be able to avoid it at 100%, but there are strategies that can help. And one of the things that we do internally is the process of calling to confirm those appointments. So having a process where the appointments that are scheduled, you're reminding the patient you have an appointment for next week, or you have an appointment for tomorrow, since depending on what your calendar looks like for availability, you may have scheduled an appointment 2 weeks back, or not 2 weeks, but 2 months back. Because you're so booked that there was nothing available within the next week or so. So that person that has an appointment that's scheduled for a month or two from now, once it's time for them to actually come by, give them a courtesy call. Because the courtesy call does not only just remind them that they have to come, but it's a courtesy call where you're going to remind them of what to do to prep for that exam, or for the appointment. So that will also help reduce that no-show, since some also do, the no-show is sometimes caused by, I simply forget, because we're all human, so we forget. And then after we forget about the appointment, then we realize, oh, I remember about that pain that I had 2 months ago. I had to go to an appointment. Oh no, it was last week. And if the center did not care enough to remind me, then what I'm going to do is that I'm not going to reschedule, but I'll just go elsewhere, which is also affecting financial as a whole. So going into call handling, and sorry for juggling between one to another, but for call handling, that's one of the most important thing too, since it doesn't only tell you about how long your processes take when you're on the phone to like schedule an appointment, but it also tells you how prepared are my folks to actually assist the patients when they call in. If there is a lack of call control, which can be identified as you're doing both your live call monitoring and the conventional QA management process with the recorded calls, you can definitely address it. A level of empathy/sympathy that's not there on calls, the recurring trainings or up trainings that you should be creating every so often will also, those are things that you'll identify as you're analyzing how long it's taking on the calls. Are we saying unnecessary stuff? Or if the calls are too short, because there's two different phase to it. There's one phase where the call may be too long, but then there's another phase where it could be too short. So if it's too short, what are we missing? What's our error rate? What are the things that our patient are saying that we're not doing? Are we very robotic? Are we just simply straight with the process? I scheduled your appointment, you're in, you're out, bam, and you're out. But are we being empathetic? Are we acknowledging some of those statements on the call? Are we setting expectations for the appointment to affect that no-show? If there were a long wait time, but it's not something that always happened, but that day you know that there's a surge in the call volume and there was a long wait time, are we telling the patient, I apologize you had to wait for longer today, but I'm here to assist you, making them know that there was an inconvenience this time around, yet you're the right person that's going to help. What's that going to do? We fall right into the last key metric here, patient satisfaction. So patient satisfaction does not only measure how satisfied am I with the end result. I called to schedule an appointment, I went and got my exam performed, but it starts the moment you pick up the phone. How easy it is to navigate through the phone tree. How fast did I get to someone? How easy was the booking process to book my appointment? How long did I have to wait? When the person on the phone said, give me a moment so I can review something on your chart. The communication, was expectations set when I needed to place the person on hold. And of course, when I asked questions with specific things that should normally happen on when I go in for my exam for the mammo and whatnot, was the answer appropriate? Did I actually get an answer? Or did I just get something scripted such as this is what you need to do based on what was read, not addressing that specific thing that I asked for? And if the person didn't know the answer, Did they ask for the time to actually investigate? Did they make me feel like they care about providing the right information? So patient satisfaction, it's true that it's not simple, but it is so beautiful that it really affects everything else. If you dissect the results for patient satisfaction, you'll be able to improve on your abandonment rate since they'll leave the notes in regards to that. You'll be able to improve the no-show rate since they'll tell you some of those things that are causing the no-show rate. They'll be able to tell you about your appointment availability. What process should you have created? Should you be creating processes where you can double book because there are simple procedures that they'll be in and out in 10 minutes, but you're booking folks for 25? So those are things that the patient satisfaction results will help you identify. And of course, ways to improve your phone tree. So I think we've gone through all the different metrics that we wanted to touch on today, didn't we, Will?
I believe we did. I believe we did, and we have a couple of other things that we want to touch on. One is communication. We want to try to make sure that we're always bridging communication gaps. This also ties back into some of the things that we talked about earlier. But one, making sure that our healthcare professionals are trained properly. Make sure that our staff have the right tools for effective patient interaction, and that they're actively focusing on listening, empathy, sympathy, and other cultural competencies that are necessary for those patient interactions. Two is making sure that they're offering clear communication. We do provide multilingual support where it's necessary, but we want to make sure that all of our patients are receiving clear communication, whether they're speaking English, Spanish, or some other dialect that we need to be aware of. We also want to make sure that we're always confirming the patient's understanding of any instructions that they may be getting. And we want to encourage our patients to ask questions and express their concerns in a timely manner, hopefully while we're on the phone with them so that we can get their questions answered and they can leave that phone call feeling like they got everything that they needed for a safe and effective appointment on the day of their appointment. And last but not least, as per usual, throughout the theme of this presentation, you want to leverage technology effectively. And what does that mean? One is we incorporate telemedicine and remote consultations if and when necessary. We want to use secure messaging to communicate with any patient provider or referral provider. And we want to also make sure that we're implementing streamlined information sharing, whether it be through EMRs, EHRs, or other repositories for patient information and protected healthcare information.
Before we move on, I just wanted to go back to offering the clear communication, Will. And I liked when you said offering English and Spanish, and then whatever other languages may be required. And I just wanted to touch on, most of the time, the centers, they know some of the prominent other languages people speak when they go to their centers or when they're calling in. Like for instance, some of the centers in Florida, there's a big need for Creole speakers. So identify that one language that is spoken a lot in that region or wherever you're located. And then if you can hire someone that can handle those interactions when the patient says, is there someone that speaks X language other than English? Being able to provide that support also makes a difference. And here I go again, talking about patient satisfaction. So that's another layer of satisfaction that you can add to it all. I may speak English, but feel more comfortable expressing myself in Portuguese because there are things that I'm not confident will be translated correctly as I'm translating in my head, and giving me the option of finding someone that speaks Portuguese while I'm on the call, when I call you in, gives me that confidence of being taken care of properly. So wanted to quickly go back there just to highlight the importance of that multi-language support portion of it, because I know it makes a big difference. Oh, we're already on the Q&A session, guys. I think we got so excited that we forgot what else.
No, do not forget about the audience, please. Thank you, Will and Stevenson. I think that you have covered a lot of ground today. This session is being recorded, so if you arrive late, it doesn't matter. We'll share with you later on. Now we are opening to Q&A. We have received some exciting questions from our audience. The first one is about technology. So given the increasing role of technology in healthcare, and scheduling. How can healthcare providers maintain a personal touch in patient interactions while leveraging tools like automated call routing, online booking, and any other tool of that nature? I think this one suits you well, Stevenson. I don't know, but you guys decide.
Yeah, I kind of figured it'll fall on me too. Because it's all about that human touch. So that human touch for me, it's about something that's friendly, I can use. So the first thing that pops to my head is whatever tool you're going to create for your patients to use, it has to be designed and user friendly based on the demographics of folks that actually you go to your center or schedule exams and whatnot. Ensuring that that technology is really patient-centered rather just simply resolving the issues you may have internally, but taking into account whoever's going to be using it. Personalized communication. So technology on one end, that'll give you straight up answers, and then the human person that's going to weigh in and am I supposed to be speaking faster? Am I supposed to be using fancier words and so on? So being able to do that personalized touch where you can combine the two, and I'll call it a hybrid option, where the digital tool is combined with the human support. And what do I mean by that? If I started my transaction with the technology, with the digital tool, then when it gets to the point where I have to speak to someone, it has to be a smooth transition from that, such as when you're using the but on a chat message. So at times it feels like you just don't know when you've transitioned from the but to a real life person. And there's two good things about that. It may mean that the bot is so well trained that it's using the correct words to make you feel like you're speaking to a human. And then on the other hand, it means that the human is well trained as well, knowing how to keep the tone that started from the get-go and not change it midway. And gathering feedback. If you're putting something out there for people to use, get feedback about the functionality and keep the human touch. And I always say, I feel like technology is here to stay, but then the human will stay as well to teach technology how to be human.
Yeah, totally nailed it, I guess. All right, the next one is the presentation highlighted staffing shortages as major challenge. So what innovative strategies have you seen healthcare organizations implement to attract and retain qualified staff, particularly in high stress areas like emergency care and specialty services? Will, I think you discussed about this earlier on.
Sure. Yeah. So a couple of things that we've noticed in the marketplace. I can speak both from the scheduling side, but also from the clinical perspective, since I also am a registered ARRT registered technologist as well, registered in X-ray and CT scan. A couple of things that I've noticed is that one, healthcare professionals are now at more of a premium than they were at any other time in our history. Part of the reason for that is, we've had pandemics, we've had, spikes in flu seasons, we've had different strains of flu, we've had different strains of COVID-19 and different things that have caused us to have more of a necessity for more healthcare workers, just in general across the board. And then two, because of that increased need of healthcare workers, the flip side of that is a shortage of healthcare workers, right? And so what happens is our healthcare workers are becoming more stressed. They're getting more burnt out. Some of them are leaving healthcare as a whole, as an industry, and pursuing other career paths. And so that means that the ones that have stayed in the healthcare industry are now at more of a premium as well. So unfortunately, one of the things that we've seen is that the pay rates for healthcare providers across all subsets, whether it's nursing, whether it's technologists, whether it's even people who are scheduling patients, they want more pay, right? So there's been a surge in the cost or the premium that comes along with being a healthcare provider, and then two is being more open-minded to things such as outsourcing for your healthcare providers, especially in areas where you can outsource, such as patient scheduling, right? Working with someone like a CCD as a partner to have access to more personnel and more qualified personnel across the board is one of the things that a lot of healthcare facilities have now are now more open to exploring, whereas 5 years ago or 10 years ago, healthcare providers, especially across the United States, were not necessarily open to outsourcing to another country or another environment for their ancillary staff members. So those are a couple of things that we've noticed, have become more prevalent. And we would encourage, all of you to be more open-minded as it relates to where are you getting your staff, how much are you able to pay them, and how qualified are they? And if they're truly qualified for the job, having things in place to help with retention are even as high at a premium as even pay rate, right? What do I mean by that? Educational opportunities. That's one of the things that we implement here at CCD. Furthering educational opportunities, work environments that are as stress-free as possible, giving your staff opportunities to interact with one another and have off-site type of activities where they get to know each other and are interacting with each other outside of the workplace. So these are all things that you can do and implement in order to have a better work environment, as well as, understanding that, healthcare workers are now at now more than ever at a premium. And unfortunately, we all have to meet the demands of the environment because people are going to continue to need healthcare. And that's just the unfortunate reality of it.
Thank you, Will. Yeah, I think you're right. All right, the next one moving forward. This is about patient demographics. Stevenson, if you want to fill in this one, I think it's a good one for you. How should healthcare providers adapt their patient access strategies to cater to different demographic groups, such as elderly patients who might prefer phone interactions versus younger patients who might favor mobile apps? And I think this is related to technology as well. So,
so as you were mentioning elderly patients, the first thing that really came to mind is, I'm going to use quote unquote, getting with the program with the omni-channels. Omni-channels, it's definitely offering those multi-channel communication methods where you don't only offer them an option to call you, but on your webpage, give an option for chatting. If you can, create an app where it makes it easier, maybe interacting and not even having to speak to someone, and you just schedule your appointment there. And in-person option is never going to go away. We know that not all centers have the in-person, but focusing on emailing, phoning, texting, and chatting that's definitely one of the biggest options that you can actually consider, since if I'm an elderly person, I may want to speak to someone just to make sure that I'm not getting confused by those prompts on the IVR, for instance. Or I may not be very versed in using your specific app. But then if I'm from the generation where I don't want to talk to anyone, that means that I will want to use your app. I will want to chat on your webpage, just because I'm on the go. So I'd rather do a chat that I can look at every so often. And the other thing that I think I would want to mention is maybe promoting that digital literacy. If you're creating online channels, don't just create them and leave them there for whoever sees them, but rather educate your folks in regards to them being available. We have chat option available. We have texting option available. And also, this is how you use our app. Release your app and release a video on how to use it, and make it very patient friendly, like user friendly, I mean. And training your staff in regards to how to give that support, and for the staff to be able to identify what channel works best for your patients as well, which is one thing that works really great, being able to tag the different charts for a preferred channel method to be identified with the chart. So if it's someone that would normally benefit from using the chat option, and they've been calling just because they don't know about it, tell them about the chat and educate them and how long it'll take them to just chat with someone. And of course, use the patient data as well, and maybe from the surveys where they are telling you what to do, to really create those options. So I think that's where we can adapting by listening. I guess that
Perfect.
closes it.
No, I think you mentioned something super important. Like we have 101 different tools, right? But how can we educate patients on using them? So that's good. This is the last one. We know that we have already covered a lot of metrics for patient access and scheduling during the presentation. How can healthcare providers effectively measure and improve overall patient satisfaction, but in regards of the scheduling process per se?
Okay, well, I'll take this one. Well, I think gathering feedback is one thing that I mentioned earlier, but then there's a way you can run surveys. We know that a lot of big companies actually work with surveys. The interaction ended and you just went through the process, and being able to say, this is a 4 out of 5, and then leaving that comment saying, I feel like this question that was asked could have been sent through an email because I feel like it invades my privacy. And I think that's one of the options, tracking the different metrics that you use to measure performance. Metrics such as appointment availability. If it's taking me 2 months to schedule an appointment with you, there's high chances that I am not going to be satisfied. Yet I'm not saying that this is not something that should happen, since I may need an appointment 2 weeks and to be scheduled 2 months from now. But if your availability does not work with my needs, then I'm not going to be satisfied. So I did mention earlier an option of possibly double booking. If double booking is something that can work because of the time it takes to go from one patient to the next, that could be something that you want to visit as an option. The wait time, tracking the wait time to see how long it's taking them to get to someone, and how easy your phone tree is to navigate through the option. And then once they've gotten to someone, how long is it taking that person to schedule the appointment? What are the hoops that you can jump those low insignificant questions maybe during the scheduling process that you can eliminate? That'll make the overall experience enjoyable for the patient. And once you've identified those opportunities, we'll call them, implement the improvements right away. And if you're not so sure about it, there's something that someone specific within the org I work for in CCD by Gibbs, he likes to say, if you want to see if it's going to work, pilot it. Do a pilot and then see what results you get from that. And once you see what the results are from piloting that specific improvement or enhancement, then you can decide if it's something that you want to launch company-wide. Maybe do it with a specific specialty. And of course, training your staff on how to handle the calls and using the technologies you're putting out for them to use is very crucial, because it will not only help you with the satisfaction, but it also help you with the overall patient experience.
Great. Well, thank you. That was the last question. Thank you, Will and Stevenson. And of course, thank you to our audience. We hope that this exchange of ideas serves as a starting point for you to start optimizing patient access. CCD Health is now part of GEBS Healthcare Solutions, a leading provider of technology-enabled revenue cycle management and risk adjustment solutions for providers and payers nationwide. Together, CCD and GEBS offer a seamless integration of patient access services and comprehensive RCM solutions for healthcare organizations like yours. To learn more about CCD Health and how we can support your organization with the scheduling or RCM, please visit ccdcare.com. Have a great day ahead, everyone. Thank you.
Bye, everyone.
Thank you.
Bye.
Thanks for joining.